Namaskar. I am Dr.Uttam Kumar Das DVM, University of Chittagong, MS Agriculture University, Mymensingh. During COVID-19 pandemic period, I think uh, all of, not all of, most of the people of the country are staying at home, and students must study um, during this time. uh, our life is going on full swing, but um, although we are in threat of COVID-19, we have to struggle against COVID-19. So best wishes for all the veterinarian and all the people of the world. So initially we have to know what is oncology. Oncology is the branch of medicine that deals with prevention, diagnosis, and treatment of cancer. So, what is cancer, and what is the characteristics of cancer? So, if we know the characteristics of cancer, um, then we'll understand the cancer. The characteristics of cancer cell: uh, rapid growth, that is rapid uncontrolled growth, less differentiation, that is anaplasia. I know you have enough idea about anaplasia. Invade within surrounding tissues. And metastasis. So what is metastasis? That is, metastasis is nothing but spreading from here to another site. This is common in cancer. Cytological picture of cancer cell: nuclear size. Nuclear size is increased, that is pleomorphism, variation in nuclear and cell size. Pleomorphism. DNA compact DNA, and bizarre mitosis, that is irregular type of mitosis, if you see the cancer cell under microscope. Then we have to know many other terminology about cancer cell. As general category of cancer cell, the terminology defines such as adenoma, that is cancer derived from granulomatous cell; carcinoma, cancer derived from epithelial cell; sarcoma, cancer derived from mesenchymal cell; lymphoma, cancer derived from lymphatic cell, melanoma, cancer derived from melanocyte, and germ cell tumor, that is tumor derived from germinal cells. Other categories I would like to discuss. Two types of categories. These are the special types: malignant and benign type. Malignant types cancer terminology ends with carcinoma or sarcoma. Benign type generally ends with OMA. For example, benign adenoma. In case of malignant, it is adenocarcinoma. Fibroadenoma, as for example, benign. Leiomyoma, that is benign neoplasm of smooth muscle. Another thing I have to discuss, that is neoplasm. Neoplasm means new growth. And neoplasm divided into two types: malignant and benign. Neoplasm normally termed as cancer. Adenocarcinoma, malignant. Rhabdomyosarcoma, malignant, that is a skeletal muscle cancer, malignant cancer. Rhabdomyosarcoma. Leiomyosarcoma, that is the malignant type of smooth muscle cancer. But in some special cases, you will get some terminology that are similar to benign, but they are malignant. For example, hematoma, hepatoma, melanoma, mesothelioma, seminoma, hepatoma, malignant cancer of liver, melanoma, that is the malignant cancer of melanocyte. Mesothelioma, that is the malignant cancer of mesothelium. And seminoma, that is the germ cell malignant tumors. Another special and common carcinoma, that is squamous cell carcinoma. We can find it throughout the we can find it throughout the many human being also. their mouth, their cervix are prone to this type of carcinoma. The process of development of carcinoma is called carcinogenesis, and some other terminology about carcinoma or neoplasia. The first one, remission. After ongoing treatment, if neoplasm or cancer is removed, that is called remission. No longer cancer or neoplastic cells are seen. But if it reoccurrence of neoplasia, it is called relapse, and relapsing neoplasia, and refractory neoplasia, that is resistant to treatment. Refractory neoplasia treatment has no action against refractory neoplasia. And very important things is that is the causes of neoplasia. The causes of neoplasia are different types. Environmental causes, that is chemical oncogenic viruses and radiation. In case of chemical, aniline dye that causes bladder cancer. Aniline dye, one type of dye that causes bladder cancer. Nicotine in cigarette that causes lung cancer. This is also one type of chemical. Aflatoxin in rodent food or feed causes liver cancer. Oncogenic virus, human papilloma virus, Epstein-Barr virus, and hepatitis B viruses. We have to remember this type of viruses, and we have to aware about the chemical carcinogen. Radiation, in case of radiation, UV light, ionizing radiation such as gamma radiation can cause cancer. Chemical carcinogen starts, it carcinogenesis in two steps. Firstly, initiating, and secondly, promoting. Initiating chemical, that is irreversible type cancer creating. Such as various alkylating agents, cyclophosphamide, polyaromatic hydrocarbon, that is used in smoked food, aromatic amine or azodine, used for food coloring agent. So be careful about taking colorful food. Promoting, that is promoting chemical carcinogen promoting. It is reversible, dependent on dose threshold, such as estrogen. Estrogen is normally used in body, but at beyond the threshold level, it can causes cancer. Drug like diethylstilbestrol also causes cancer, but these are reversible chemical. So some common clinical sign of cancer. Common clinical sign of cancer: anemia. If you suffer from leukemia, there may occur anemia. Leukemia, term leukemia, a special type of terminology. Hemangiosarcoma, another term, that is carcinoma of blood vessel. So common symptoms are anemia, short breath. Anemia relates to short breath, abdominal pain. If carcinogenic changes within the abdomen, or any other vital organ, abdominal pain may occur. Persistent fatigue, loss of appetite, chill, diarrhea, fever, bloody stool, various types of body lesion, skin mass. In case of causes of cancer, age is the another factor that is overaged people are prone to cancer. The old age or overaged. Genetic another factor. Genetic such as retinal sarcoma. In case of retinal sarcoma, there is a absence of a anti-oncogenic substance causes retinal sarcoma. It is genetical cause. Hormonal cause already discussed. Smoking, it is already discussed. Drinking alcohol, obesity, sun exposure, immune disorder. Immune disorder can cause cancer. Also, the term neoplasm derived from Greek word, and tumor term derived from Latin word. Neoplasm means new growth, that is uncontrolled growth, invasive, that invade to other tissues, and metastasis is the common in case of malignant neoplasm. This is already discussed, but you have to differentiate between aplasia, anaplasia, dysplasia, metaplasia, and neoplasia. Dysplasia and metaplasia, this very rarely turn to neoplasia. Metastasis, that is transformation of cell, is a normal phenomena of body, and dysplasia can be a normal phenomenon, but not necessarily causes cancer. So you have to differentiate, also differentiate cancer masses with cyst, hematoma, or other encapsulated growths. one type of terminology I already mentioned, that is wrongly pronounced. That is genetic or hereditary. The correct term is retinoblastoma. And now some approach about diagnosis of neoplasm. Diagnosis of neoplasm. We have to consider history, symptoms, as well as laboratory test, biopsy, that is examination of living cell. That includes aspiration, that is needle aspiration of some parts of neoplastic cell, or whole removal of neoplastic cell, and then examination under microscope. Already discussed the characteristics of neoplastic cell. The nucleus is large in size, proliferation of cell, and that is differentiated anaplasia, embedding into another tissues. Perhaps hematology. Hematology, of course, is taken because hematological picture determine the neoplastic growth, such as leukemia. You will see the blood picture, and you can also collect fluid through lumbar puncture, X-ray for the site and extent of the neoplastic growth. Special term used for diagnosis of neoplastic cell, that is tumor marker. Tumor marker such as neuroblastoma is diagnosed by increased neuron specific amplitude, that is NSE. Germ cell tumor diagnosed by alpha fetoprotein AFP, etc. Staging of neoplasm is very important for treatment of neoplastic disease. What type of staging, grading, very important. You should go through the books. I am giving all a basic idea about cancer or neoplasm. Treatment includes firstly curative treatment to destroy the cancer cell, and palliative treatment includes uh, minimization of symptoms and pain. In case of surgery, preoperative chemotherapy is used. This is to shrink the tumor, and then surgery is done for complete resection. Treatment, in case of treatment, a special term is used, that is prosthesis. That is artificial replacement of limb. Prosthesis. This is done after amputation of limb. Chemotherapy, many people know about chemotherapy. In case of cancer, chemotherapy is used, they know it, but this is the major concern about for pharmacologist, and a major research subject for scientists. Chemotherapy, cytotoxic drug. These cytotoxic drugs are used to destroy the cancer cell. Central line, that is a needle is pushed through the chest by a special catheter that is called Hickman catheter. Radiotherapy, in case of cancer treatment, two type of radiotherapy used, external and internal. The external radiotherapy is done from exterior of the body, and some radiotherapy used within the body, that is called internal radiotherapy. And in case of radiotherapy, fraction, the fraction of dose is very important, and normally one fraction per day, and hyperfraction is more than one fraction per day, that is called hyperfraction. For radiotherapy, more important thing is the radiotherapy field. You have to identify the radiotherapy field so that you can properly treat the cancer cell. Special terminology about radiotherapy in cancer, that is TBI, total body radiation. Total body radiation. This is done before the bone marrow transplant. So today we understand something about oncology, neoplasia, tumor causes, symptoms, diagnosis, and treatment about cancer. Um, Again, some I have to shortly discuss before leaving this session. Um, oncology is nothing but an important division of medicine that deals with the prevention, diagnosis, and treatment of cancer. Neoplasm is also